I'm Braden Balderas, and I went to Uganda. The focus of the fellowship was on health, so I primarily looked at malaria and the diagnosis of malaria and the treatment of malaria, but I also found a pretty interesting coffee story, which was very fun to report on. I was often confused as a member of an NGO or someone with a donor agency, and I had to go to great lengths to kind of explain what I was there for. And even when I did that, I didn't always feel like that sunk in. So whether or not that's just this perception of someone from the Western world that you are always there as a part of a government agency or some sort of NGO, that it's difficult to kind of break through. I did have any number of people too, though, who were very happy to talk about malaria and the reasons why they were trying to improve malaria treatment, why they were trying to improve malaria diagnosis. And I did have several people kind of going to what Anne was saying, that they did want to tell their story to say, you know, thank you so much for coming and talking to me and really trying to understand these issues better. One of the challenges of being a foreigner in a country is that the cultural dynamics that are present are not always very clear to you. So I was in an English-speaking country, but I still felt sometimes that I really wasn't quite sure of what was actually going on. So I would either ask somebody or try and clarify in my questions, and I did feel that there was this sense, partly because I think they thought I was with an NGO, that they wanted to tell me all of the positive answers, all of the right answers. So, you know, no one had ever said that they didn't want to have this particular test. But when, you know, research has clearly shown that people do say, I don't believe this test, or I don't want this test. But I wasn't always able to get that answer out of people because there was a sense that they wanted to tell me exactly what I wanted to hear, which is, it's always working. So I did try and encourage people, you know, I want to hear what really goes on the ground, and I think it just involves trying to be creative with your questions and also, you know, letting them know that you're not here, it's not a gotcha interview, that it's just really, I'm trying to understand what are the challenges that you face as you are trying to get care and treatment to people on the ground. As a woman reporting, there is certainly a certain sense of vulnerability that I felt, and I know other women have felt as well, in terms of just being very aware of your surroundings. I think that's very important, and check it, especially if you're traveling by yourself, which we all were in our fellowship this time around, checking out the places where you stay. I did have one instance where I ended up being the only person on the property, so, and I was staying in a pretty much a hut. It was a nice hut, but it was a hut with doors that someone could have very easily busted down. So,
and no electricity, you said.
And no electricity, so I had 2 lanterns and 2 flashlights, so that was pretty much my defense, and the chairs that I put up against the door. So thankfully nothing happened, and I was very happy to see the sun the next morning. But so that was really the only problem I had, and I think that if I had maybe checked out the place a little bit more, even though it was recommended by somebody. So those are just things that you might not anticipate, but that would be good to think about. And then in terms of just dealing with people and different services that you might need, like driver services, trying to get those people recommended, and then really getting upfront what you are agreeing to pay for, because we did have one instance where thankfully I was with somebody else, another woman, but the driver really ended up giving us a very hard time at the end, and got pretty verbally aggressive with us. So thankfully it was smoothed out, but you know, those are definitely things